How do you think that New South Wales is tracking here?
I think that they're struggling a bit at the moment. Numbers aren't huge at the moment, which is a good thing, but the potential exposure is enormous, especially with the bottle shop. So maybe we just have to cross our fingers and hope they can get this under control.
Well, let's talk about that bottle shop cluster. We've now got thousands of people being told to get a test and isolate. How concerning is this particular cluster?
Look, one of the reasons it's very concerning is in South Australia, their recent outbreak, and in Victoria, they did the second ring where they looked at the close contacts of the close contacts. Now, if each person has, let's just say, got 10 close contacts, that means that for every infected person, you have to investigate 100 people and have them in isolation or quarantine. Now, when you start getting potentially 15, 20,000 people exposed, and you want to look at their close contacts, it goes totally out of hand, and the contact tracing simply can't manage, and that's what they're facing at the moment.
With this particular cluster, genomic sequencing has linked it back to a patient transport worker who then passed it on to a colleague. Can we take some comfort, Adrian, that we do have a known source to this cluster in particular?
Yeah, and that always helps, only because it helps us work out what happened and how we can try and prevent it in the future. But getting this under control is far more important than working out where it came from.
How do you see case numbers playing out now in the coming days or weeks? Are they likely to juggle around, do you think, or are we going to be seeing consistent case numbers?
It's very difficult to tell. I mean, we've got the issue of New Year's Eve coming up and potential of mass exposure there. We've got Sydney cricket test coming up. I've really got no idea what these New South Wales government is thinking of having a cricket test in the middle of an epidemic or an outbreak. So look, I think in Victoria they appear to have it under control, which is fantastic. And so I'm much more happy with the way that's working out. Although if I was Victorian, I'd be livid about it coming across from South Wales. But in New South Wales, I think they're going to struggle to get this under control without a proper lockdown. They should have had a lockdown when this first started. Of course, they don't want to do that.
We're now weeks into these clusters, Adrian. We now have a mask mandate. How big of an impact will that make?
It will help, absolutely. But they should have done this 2 or 3 weeks ago. It's now 18 days since the first case was reported. They should have immediately put in mandatory face masks. It's low cost. Most people are quite happy to wear a face mask. It's not that much of an intrusion. And I simply cannot understand why they weren't willing to do this immediately.